Good morning, everyone, and thank you so much for coming here today to join the webinar with Dr. Vikram Chauhan. And before we start with the webinar, I would like to give a brief overview of who Dr. Vikram Chauhan is. He is an Ayurvedic MD doctor from India. He has a degree in Bachelor's of Ayurvedic Medical Sciences. And he has been practicing for many years, like over 20 years in Punjab in India. And he has a herbal company for which he's the CEO and founder called Planet Ayurveda, which makes many herbal medicines and herbal juices, herbal supplements, which he has used successfully in being able to heal patients from very chronic illnesses like IBS, ulcerative colitis, low ITP platelets, and even liver cirrhosis, where the patient was recommended to get a surgery, but using both modern medicine as well as Ayurvedic treatment, the patient recovered without needing the surgery. So he has literally been pretty much a miracle man in terms of healing through Ayurveda. The wisdom comes right from our sages in India, but to be able to understand and apply those Sanskrit texts into practical applications towards healing is definitely a big talent, which Dr. Chauhan has learned through his journey from his degree and into his clinical practice. And it is wonderful to have him here today. Thank you, Dr. Chauhan, for coming in here today to share more wisdom on Ayurveda with us all, especially to the audience out in the West who might be new to Ayurveda. And today he will be sharing about how Ayurveda can help heal spinal injuries and also how it can help in lower back pain. So Dr. Chauhan, I will pass the mic to you now to go ahead and share with us more wisdom on Ayurvedic healing. But before I do that, a little disclaimer. This webinar is for information purpose only. There will be no private consultation given here to anybody for any treatment. People have to contact their doctors directly, or if they want to get in touch with an Ayurvedic doctor or Dr. Chauhan, they have to do it directly. Our platform is only for the purpose of information, no medical cure or treatment. Any problem if you may have, you should consider your primary care physicians, and it is not to replace any conventional allopathic treatment either. So we are trying to only propagate the wisdom through this webinar. So thank you so much for everybody for coming in, and thank you so much, Dr. Chauhan, for being here with us today. And I will now let you start the webinar and bring us more light on the wisdom of Ayurveda and how it helps spinal injuries. Thank you.
Thank you, Gauri. Thank you for hosting me and choosing such a wonderful topic. It's very common. And first of all, my best wishes to all of you. Happy New You. One is Happy New Year. Everybody is saying Happy New Year. My wishes are Happy New You. So leave everything in 2021. So I wish you become a new you. That is, you are not trying to change others. You try to change yourself, not blame others, try to mend yourself. So I wish happiness for all of you. So Happy New You and Happy New Year for all of you. And coming to the topic of today's webinar, the spinal injuries and back pain, and how we can heal them using ancient wisdom. That's very much possible. There are so many reasons for backache, particularly you will be surprised that it's the most common ailment with patients. They come to the physician's office. It is one of the most common. I have worked in orthopedic OPD also, and I have seen so many patients complaining about the back pain. And the issues are so many weird issues, so many variations why there is back pain. So it is very important for the doctor to diagnose the real cause. So I would like to tell people that most commonly it is not very serious. It is scary. Sometimes people, they get scared because of the severe back pain they have, but usually it is muscular or muscular injury or muscular strain or it's a muscular pain, not really because of complicated disorders. So people should not worry too much about the back pain, but they should be cautious and they should not ignore it. It's if there is acute pain, it is mostly due to lumbar strain or muscular. Usually above 35 or 40 people, they suffer from it. The muscles, because the muscles, they become weak and people are not exercising, and in men the bellies, they come out and the strain is there on the back muscles. In women, they are not, if they are not exercising and they are pregnant, and after pregnancy also very fat, and they are not exercising and getting heavier, that also leads to strain on the back. There are sometimes postural problems. People are sitting in a humped position for long sitting hours nowadays. That is also one of the reasons of lower back pain. Infections in the urinary tract or uterus or ovaries, or such infections, pelvic inflammatory diseases, they can also lead to lower back pain. So these are not, in case of inflammatory or infectious problem, there can be fever. So in other condition where there are only sprain or strain is the cause, so there won't be any fever. And the patient's age is very important. If patient is the clinical presentation, we can analyze what can be the reason. If the patient is young and he is complaining, he or she is complaining, that means most probably it is because of the injury, because of the muscular injury or sprain or strain. He or she might have lifted something heavy, or maybe pulled something or pushed something. That's the strain of the muscles. If the patient is above 55 or 60, there may be degenerative changes. Our spine is having these vertebral columns are there, and in between the column there is disc. So disc, it can move up ahead or backwards. So due to some injury on the back, it can lead to the discopathy or disc prolapse. So that can lead to sciatica. The nerve can be pinched and it can cause the pain radiating to the lower leg. So that is very painful, and that needs a lot of rest also. So that can be the cause, the disc prolapse. In disc prolapse, usually the pain is severe and it is radiating to the lower leg. So that can also be corrected by some rest and some exercises, but don't exercise when there is acute pain. Sometimes people, there is pain, there is injury, and there is strain, and they do exercises. So that is not recommended. I was explaining all this from the modern perspective. from modern medicine perspective, how to diagnose and how to analyze what kind of back pain is there and what can be the reason. Some osteoarthritis can also be the reason. Usually the disc prolapse is between the L5 and S1, because L5 is lumbar vertebra and S1 is the sacral vertebra, the lower back, and that is the most vulnerable position of the prolapse of the disc. So L5, S1 disc is usually, it comes out of the vertebral column, and that causes the pinching of the sciatic nerve, and that leads to problem. So knowing the anatomy, I'm talking about the patient, not only about the doctor. If you are a patient and you have severe back pain, what you should do? You should first of all know the anatomy, what is the problem and how you can correct it. Just imagine, these are the two vertebra. This is bone, this is bone. In between the bone, there is a round disc, and that disc, it has come out towards the back. This is your front side, and this is your back side, and that goes towards your back. And this space, it reduces, and the nerve is coming out from here. So the nerve is getting pinched, trapped in between the vertebrae. So that is causing the pain. And the solution is, you pull it downwards and push the disc inside. So this way, how you can pull it? You can do the Bhujanga asana according to different yoga posture. I'm telling you, this is a posture called cobra pose or snake pose or half cobra pose. Half cobra pose, it is like this disc went backwards because you pulled it like that. You bent forward and you pulled something, and the disc went backwards. So now you, in order to put it back, you need to stretch the back like this, bend the back like this, like a cobra, like a snake. So you can see Ardha Bhujanga Asana over YouTube. There are so many yoga teachers, they can tell you how to do Ardha Bhujanga Asana. So do it every day, 10-15 minutes, and then it can help a lot. And there is an oil I would like to recommend. You can do the oil massage also. So you can just boil in some Ayurvedic herbs in mustard oil or sesame oil. Just take some sesame oil and heat it, warm it. Take some herbs like ginger, turmeric, onion, garlic. These are anti-vata herbs for the vata. In Ayurveda, lower back pain or the muscular pain or the bone pain or all kind of pains, they are caused by vata imbalance. And the seat of vata is the lower pelvic or the colon. So if there is constipation, if there is a pelvic inflammatory disease or any degenerative disorder or bone inflammation or the muscle pain, anything is caused by the vata imbalance. So it is very important to balance the vata, and to balance the vata, we need to put some oil on that. So you can make the oil at home. Just put in these herbs in water and boil the water using this ginger and turmeric and garlic and all these warm and heating herbs. And then you can just strain the water. When it is made into a decoction, take about around 20 grams of each herb, and then about like 200 ml of water. When it means about 50 ml, 1/4, and then you strain it and put it in the about 50 ml of oil. And when you boil it, and then it remains half, and then you can use that oil. That becomes your pain relieving oil. That is very strong. You can even, if you have castor around you, you can put castor leaves also in that, as a herb in the beginning. So there are more herbs like ashwagandha roots and harsingar. So other herbs, if you get them, that's okay. Otherwise, in the kitchen you can get turmeric and cumin and thyme, ajwain. These herbs you can get in the kitchen also. Indian spices. Even the cloves are good. So they are your kitchen has all the herbs. So this back pain, it's a painful situation, and people are running around and they are advised surgeries. They are advised so many painkillers and injections of steroids and so much cumbersome procedures. It is not difficult to heal back pain, and the same decoction of herbs. You can just consume it like a tea once per day. And also take something to clean your colon. Once your colon is clean, then the vata is down, and consume some this castor oil or almond oil. So it's a very basic principles of vata, pitta, and kapha. You have to follow them. And once the vata is in controlled situation, then this back pain goes away. Problem is people are having, they are not looking after the cause of the problem. They are eating too much, they are gaining weight, their bellies are out, and the whole pressure is on the back. And the sitting hours are long over the computer. Ayurveda says if you don't get rid of the cause, then you cannot solve the problem. So it is very important to know the cause and focus on the cause, and then focus on the solution. I would suggest everybody to go for Ayurvedic solutions first. These are very basic. We do Kati Basti also. Kati Basti is just, Kati is called back, this back area we call Kati in Sanskrit language. So Kati Basti, Basti is something made from the oil. We put in we make a barrier at the back. The patient lies down in supine position on the belly, and the back is upwards. And on the back, we make a barrier with the floor, with the gram floor. We make a black gram floor or urad dal. We make a barrier, and then we put in some warm hot oil. It should not be so hot that the person is having burn injuries after the back injury. So don't cause that. It should be very lightly warm. So you put the oil, you keep the oil there. That is called Kati Basti. Keep it for about 15-20 minutes. That will relax the muscles there. So those muscles which are gone stiff, they will be healed. They will be relaxed with this Kati Basti. And even the disc, if it is prolapsed, that will also go inside slowly, because the ligaments and tendons in that area, they will relax, and slowly the body will get time to heal itself. So not only in back situation, inflammatory conditions of the back, but also in every other disease. We have, in Ayurveda, we have natural ways to heal the body, to give time to the body to heal itself. What happens in modern medicine, we don't give time to the body, to our own cells. We just provide help to the body. Immediately, we give solution. And those solutions, they cause more complication. So we should not be in too much hurry to get the surgery done. In most of the cases, people, they just go for surgery immediately. They decide quickly. Just take 2-3 doctors' opinion in modern medicine also. If one surgeon has suggested you surgery, the other surgeon may not suggest you surgery, even in modern medicine. So just be patient, be slow, take 2-3 opinions, and then meanwhile, you keep trying Ayurveda. And I'm very much sure your back pain will be resolved. And these two oils, this oil as well as this Ardha Bhujangasana, in modern system, there is no, there are chiropractors, they are doing some stretching, and they are good in this sprains and strains. But if there is some serious disc prolapse, that can get aggravated also if it is pulled in a wrong direction. So you have to be very careful while pulling and stretching. So lower back pain sometimes due to licoria also. In women, licoria is also one of the causes. As I told you, inflammation in the pelvis or infection in the pelvis or in the uterus. So that can be the cause also. So keeping in mind all these causes, we can take care of the back pain. Keeping the back warm is also recommended. And I'm not very much in favor of support, giving too much support like belt or all those things. It can be temporary, it can be for some time, but all the time just putting in the belt and not following other things like massage or the relaxation or the rest, just working and traveling with the belt on, that is not going to heal the muscles. That is just giving you more support, and you get addicted to that support. It is just like providing some temporary support to somebody who is not working. If you have somebody who doesn't want to work, you give him money, he will lose the interest in working. So he will become dependent on you. So it is better to guide him to work on his own instead of providing financial support to him. Just give him moral support or give him some guidelines, so he will work. Similarly, if we give just physical support to our muscles, then it depends on patient to patient also. If there is acute or serious injury, then it can be given for some time, but not for. Just try to estimate what kind of back pain I'm having, what kind of injury is there, but don't panic. Mostly, as I told you, it is very simple reason. So any you want to ask any questions?
So people can raise their hands, and we can then go one by one and let people ask.
Because in questions we can elaborate more. These
Yeah.
things, there can be different reason in different people and different questions.
Yes, so people can raise hands, and then we can just ask them to unmute one by one and ask questions. So if anyone has a question, please raise your hand. Somebody, Johnner. Okay, Johnner, you want to go first?
Hi, thanks for the talk. It was good. It was informative. Somewhere in between, you were telling like usually the lower back injuries or like the pain is caused due to vata, right? So
Yeah.
will you be able to give us like, I think I have read somewhere or heard somewhere like we can compensate this by other food practices which increases our pitta and kapha, right? So will you be able to share those things? As you said, like I think this is a way we can understand our own body, like why we are having this pain and what could be done on a day-to-day basis, which could help us solve this.
Yeah, thank you for the question. So it was very important question, and it is going to tell you so many things. We are actually governed by three energies: Vata, Pitta, and Kapha. Vata is air. It is responsible for the movement. Pitta is the metabolism, metabolic fire. Pitta is the fire. And Kapha is the structural energy, or the which is giving form to the matter or matter of the body, the strength of the body, stamina of the body, or these are the universal energies, Vata, Pitta, and Kapha, which are present in our body also. And the universe, these Vata, Pitta, Kapha, they are representing the five elements. earth, water, fire, air, and space. These 5 elements, earth, water, fire, air, and space, they are present in the whole universe. And earth and water, if we join them together, that becomes kapha. And the fire is pitta. And the air and space is vata. So every individual is made up of these 5 elements. Every individual: earth, water, fire, air, and space. So in back pain or in any nerve pain or back pain or any kind of pain, vata is involved because vata is responsible for the movement. And the food is also made from the 5 elements. So any food item which is having more vata, that is going to increase the pain. And secondly, your own body type or mental type is also can be vata predominant, pitta predominant, and kapha predominant. So vata people, they are more prone to such pains in the nervous system or in the bones. So the food which is increasing the vata, first of all, the individual person should try to identify what is his or her body type, the constitution or the physical constitution, but how much percentage is vata in his body, how much percentage is pitta and kapha. This composition is natural and by birth. It is a composition of vata, pitta, and kapha. It is determined at birth and it cannot be changed. So if you are a vata person, you are prone to such problems. If you are a pitta person, that means you are prone to some other kind of heat imbalances. And if you're a kapha person, that means you are prone to high cholesterol, heaviness, obesity, thyroid, such disorders. So our food is influencing our body at physical levels and also mental levels. So vata increasing food will aggravate the vata and will aggravate the pain. And vata pacifying food will definitely help to reduce the pain. So vata pacifying food is any food which is warm, opposite to the properties of vata. Vata is cool, so any food which is warm, it is good for vata. Any food which is like warm oil, application of the oil and consumption of the oil. For example, you can consume almond oil, you can consume castor oil, 1 teaspoon or 1 tablespoonful once or twice per day. Almond oil, that is good for gut cleansing also. This castor oil is good for gut cleansing, and almond oil is good for the relaxation of the nerves and also cleansing of the colon and lubrication of the joints. So almond oil, castor oil, they are anti-vata oils. So all oils are recommended. Olive oil and flaxseed oils are also. And anything, that's why I recommended warm herbs. Turmeric and ginger, they are warm. So you can make a decoction of turmeric and ginger. And that is heating. That is increasing the pitta but decreasing the vata, because vata is cool, and these 2 herbs or other herbs also, they are heating, they're warm, and they are reducing the pain also and inflammation. So they are, although they are pitta increasing, but they are kapha and vata decreasing, because vata is cool. And anything which is heavy like oils, that because vata is light and opposite to light is anything which is oily. So that is also good for the vata pains. Some people in India, they say, because it is our tradition, Ayurveda is our tradition, it is there in every house. And if somebody complains of pains, so the older generation used to say, so he or she is having vata pains. Or in Hindi, it is called Vayu ki darde ho rahi hai inko. This is the what is said in Hindi. So Vayu pains, these are vata cramps or vata pains. So to balance the vata, we need to consume food or do certain behaviors which are not vata aggravating, which are vata reducing. So massage is also vata reducing, and anti-anxiety exercises or meditation is also vata reducing, and this oil consumption is also vata reducing. Any packaged food, for example, biscuits or chips or anything which is dry, that is increasing the vata, because vata is drying in nature. Vata is not oily. Vata is not humid. Vata air is drying. So when the air is blowing, the clothes, you can say, they dry quickly. So vata is drying. So anything which is oily, opposite to dry, that should be consumed. Some oily and unctuous or hot and warm food is good. These foods like packaged food, they are dead foods. They are not living foods, so they should be avoided. Biscuits and these chips and some food items uh, like peas, mushrooms, French beans, they can also increase the vata in the gut. They are they cauliflower, they cause gas in the gut. So that gas forming food should also be avoided. Spices are good because spices like turmeric, ginger, and all other cumin, fennel. After every food, one should consume fennel, 1 tablespoonful of fennel seeds. So that is balancing of the vata. So this way, food which is balancing the vata should be consumed. And late night sleep is also causing vata imbalance. So late night sleep should be avoided. And travel is also causing the imbalance of vata. So travel plans should be cut down whenever you have such back pain, and because that is going to increase the vata. And a lot of thoughts, too much thinking, that is also vata increasing. So meditation is just to cut down on the thoughts. So meditation is also relieving anxiety and panic and reducing the vata. So I hope this answer will cover basic information about Ayurveda also.
Okay, so next question we have from Melanie. Melanie Martin, you can go ahead with your question, Melanie.
Yes, Melanie.
Hi, Dr. Chauhan. Thank you for speaking to us again today. I just
Yeah.
wondered, in general, can I assume that if I have lower back pain as well as burning in the abdomen, that there's inflammation?
Yeah. Whenever there is a patient I see complaining of back pain, first of all, I try to assess from the age of the patient. What is the age? What is your age?
55 to 60.
55 to 60. So most probably it is little bit degenerative also. Plus if the pattern is coming on and off, the back pain is dull pain and it is coming and it is going, sometimes becoming severe, sometimes normal. It is also because of the weak muscles. So weak muscles combined with a little bit of degeneration. It is not acute pain because of some sciatic nerve or some disc prolapse or something. So mainly muscles are involved. Muscles are weak. That is one thing. Other thing, you told me that you are having acidity and burning, heartburn, certain disease, certain problems.
Correct.
That can be because you might have consumed some tablets to stop your back pain, like Advil or something like that.
No, I don't have any medication in my home except homeopathic.
Okay, that's good. So acidity or this acid peptic disorders, this is also caused by allopathic painkillers and some foods, some spicy food, or sometimes can be milk products in some cases, sometimes can be late night food or sweets or fermentation due to the wrong combination of foods, consuming milk and milk products along with some sour, consuming a lot of coffee. So any food item which is causing, you should observe which food is causing increase in your acidity. So you should stop those foods. You should cut down. And the pH of the gastrum or the stomach, maybe it is lowered because of the coffee or because of not consuming enough water or not consuming enough alkaline food, not consuming fruits. So that may also cause acid peptic disorders, or too much full stomach food. That can also be the cause of acidity. So if you do some fasting in a day, in a once in a week for a day, and on that time you consume only something like warm soup with ghee, that can help you to overcome this problem of acidity and acid peptic disorders and gas formation, and avoiding of these cauliflower and cabbage and raw salads for some time, for 1 month. That will also reduce the gas formation or acid peptic disorders.
Okay, and according to what you said earlier, I also need to avoid late night sleep and too much thinking. I don't drink coffee. I don't drink coffee either, and I don't drink cow's milk, only almond or coconut.
Mm-hmm. But consuming too much food at one time can also cause gas and bloating.
Uh-huh.
So you need to observe your pattern. What increases the acid or what increases the gas. So you need to cut down on those foods.
Okay, thank you.
Of course, late night sleep is very big reason for acidity, because we have certain hormones which certain organs in our brain, which are we have certain, I will explain you. Like animals, we have certain sensors in our eyes. Animals or humans, we have the same sensors behind our eyes, on our retina. They give the information to the brain that the light is going, the sun is going down, and the brain immediately gets that signal and immediately releases some hormones, this melatonin. And that melatonin goes to the different organs and tells them to shut down, to cut down the digestion, to stop the digestion, to reduce the heart rate, to reduce the respiration. And same is happening with the animals in the forest. And they are planning to sleep when the sun goes down. But humans, they are not planning to sleep. They just plan to go to some other places, to party, or some holiday or some disco or some. You cannot imagine animals organizing a disco party after midnight. So humans, we have gone weird. So that's why we are facing such diseases. So diseases can be cured naturally. Just follow our connection. We have connection with the universal energies. We have connection with the universe. So we need to know the rhythm of the universe. Need to know the rhythm of the day, follow the rhythm of the night, follow the rhythm of the seasons, and follow the rhythm of the life, the universal energies. So that way we can understand our connection with the universe.
So in Canada, it now gets light around 5 p.m. What it would be an optimum time to go to bed? Because my goal is to get to bed before midnight.
Before midnight is okay, like 9 o'clock, 9:30 in Canada.
In Canada, yeah.
Yeah. So that is for Canada, but for other places like India, it should be earlier. But still, it's okay. Before 9, I mean, you don't eat 2 or 3 hours before sleep.
Mhm.
I
Okay.
mean, should be done with your dinner by 7 o'clock, 6 o'clock. And then you should be sleeping by 9:30 max.
Thank
So
you.
that's, yeah. And when is the sun rising in Canada?
Now around 7-ish, 7:30.
7:30. Okay. All right. So that's a long night.
I wake up at 5 or 6.
So try to get up earlier. You will automatically get up early once you sleep early.
Mhm.
Yeah.
Okay, thank you very much.
Okay. Yeah.
So
You
your
also
next-
do this Ardha Bhujangasana also. Ardha Bhujangasana, this exercise to strengthen your lower back muscles. You can read over YouTube this half cobra pose. So this is very easy on the back. Like you don't have very serious back problem. It's just muscular weak muscles. So to strengthen, just like muscle training, you go to gym. Similarly, doing yoga, mild yoga, not too much. So this will strengthen your back muscles.
Okay.
So next is Pankaj Vyas. Pankaj Vyas, do you want to go ahead and ask your question next?
Namaskar. Sir, is Vata related to muscle cramp and how to we can cure with Ayurveda?
Very basic. Vata, as I told you, is light and cold and dry. Any food which is opposite to light. Opposite to light doesn't mean that you should eat very heavy food. You can consume which is having oily and warm. Opposite and oily with ghee. So that ghee or oil is going to balance the vata. The spices are going to balance the vata. The warm soups are going to balance the vata. Massage is going to balance the vata, reduce the vata. So opposite to this, too much physical or mental exertion or running or traveling or late night sleep, it is going to increase the vata. So for muscle cramps and everything, as I told you, the oils and the massage and deep sleep, meditation. These are the ways to cut down the vata.
But Vata, when we say that we should consume oils, that means like ghee or castor oil, not refined oils.
Yeah, no, not refined oil.
And
Yeah.
not does not mean that we should be eating fried food from outside or cooking
No,
puri or anything. But
that is refined oils. Anything which is fried is like a poison to the body. So
Sir,
once you
can we
fry,
treat to
huh?
sir, can we treat to Panchakarma therapy?
Yes, in what we do in Panchkarma, we are just in Abhyanga. Abhyanga means massage. We are using anti-vata oils, herbs, medicated herbal oils to balance the vata. That is what we are doing in Abhyanga. Abhyanga is massage. That is what we do in massage. And Shirodhara, we put the oil, warm oil on the forehead. So it's calming down the thoughts, slowing down your movement of the thoughts in the brain. So Shirodhara is done. Vasti is enema, medicated oil enema. We use the oil enemas to cut down the vata, to reduce the vata. So we put the oils, warm oils in the colon, and that warm oil comes out. And along with that, it brings out all the vata. So vata is balanced. So this is done to balance the vata, panchkarma.
Okay.
Yes, Gauri.
So we will move on to Amrita. Just one little point that Sival has put in the chat, that if we are familiar with grounding mats, and that has helped reduce her back pain. She has no back pain. She sleeps on that. And also ground with bare feet. So she said that that grounding mat has been very effective to sleep on that with the bare feet. And
That's good.
she has a question, but we will go ahead with her question after Amrita. Amrita had the question first, and then we
Okay.
will go with Civil. She's asking about medicines or herbs. I think she came in to enema.
I can read. I am reading the chat from Civil.
So we can go with her question after Amrita. Amrita had the question first, so maybe
All right.
we can go ahead
Okay.
with Amrita first. Okay, Amrita, you can go ahead with your question first, then we'll go on to Civil.
Good morning, Dr. Chauhan. Thank you for the
Yes.
session.
Good morning.
I had a question related to the psychology of Ayurveda, because you talked about source of the pain.
Yeah. Yeah.
And a lot of the times I find that lower back pain has to do with stress.
Of course.
So sometimes I just listen to the body and what you were saying, going according to the rhythm of the universal consciousness. But I also wanted to point out, I read this book called Healing Back Pain, The Mind-Body Connection by Dr. Sarno. And he unknowingly does take an Ayurvedic approach to the psychology of pain and how to treat it. Can you address that? Because I know in Ayurveda, they also talk about that. Please. Thank you.
Amrita, first of all, like last time also, you had very beautiful background, and today also, I like your background.
This is a real one. It helps my students.
Yes, this is helping me too. Very nice and peaceful and calm. It's calming down the vata. So, of course, mind-body connection is always there. The vata is imbalanced because of the thoughts, because our emotions, our feelings, our hormones, that they are represented, they are controlled and governed by the vata energy. They are responsible for the movement in our body. They are responsible for the heartbeat, for the respiration, for the nervous system functioning. So all the automatic nervous system and voluntary nervous system is governed and controlled by vata. So vata is, as the property says, it is mobile. I told you 3 properties of vata previously. That is, it is dry, it is cooling, it is minute, and the 4th property is mobile, the mobility. So wherever you see the mobility in the body, the blinking of the eyes, the beating of the heart, the respiration or the bowel movements, this is, or the locomotion or movement of our hands and feet and back, and wherever you see the movement in our body, it's by vata. So vata is responsible for the mobility, and controlled or uncontrolled, voluntary or involuntary. So the movement is because of the thoughts. Your heart is beating because of your, the heartbeat is sometimes controlled by the thoughts also. So psychosomatic connection is always there. That is very important. If I bring a lion in front of you, you will be scared and your heart rate will double instantly. How this will happen? Because of the vata, because of the adrenaline. And from where the adrenaline came? It came from your fear, from your thoughts. Even some people are scared. They are having the same reaction with the dog. If there is a pet, if I bring my pet in front of you, maybe you get scared and you have same reaction, but I am not having that reaction. So that means my thoughts are different and your thoughts are different. Similarly, people are having different reactions to different situations and circumstances in life. So their reactions are the cause of stress. Stress is nothing but reaction to our circumstances, our situations. So some people are taking the stress, some people are not taking the stress. If I give you something, it is up to you whether to take it or not take it. So same is the situation with the stress. For example, if I give you something, if I give you stress, people say, he gives me stress or she gives me stress. No, you take it. If you deny to take it, nobody can give you something or anything. So don't take it. Don't accept it. Don't take stress. It is up to you. It is your decision. That's why I said happy new you. So I wish you to change your thought process. Not yours only, but everybody else. So become new you. Don't accept stress as part of life. Don't let anybody control your feelings. Don't let anybody become your remote control. So of course, all the body pains, fibromyalgia, severe pains, they are caused because of the stressful and stress and fear and phobias, so many mind issues. So it is very important to meditate. Thank you for bringing this question.
Thank you.
I think Sybil had a question in the chat box. She said, if there are any medicine or herbs to enema.
Yes. All these anti-vata herbs are there. Ashwagandha is there, Bala is there. Bala is a wonderful anti-vata herb. So there is Bala Ashwagandha oil that we make with sesame oil as a base. So just instead of mustard oil, we use sesame oil and we boil the herbs in the water. There are other oils like the Dhanvantram oil. The Dhanvantram oil is very good for massage. There are so many herbs, like 40, 50 herbs in the decoction. We boil the herbs and then after boiling, we strain the water and that water goes into the oil and then we heat up the oil and the water evaporates and that oil becomes medicated oil. So those medicated oils we use for enemas, we use for massage. Those are called Panchkarma oils. There are different types of Panchkarma oils for different kind of health concerns. So we are using a lot of herbs to make these oils and they are available in abundance. God has given us a lot of things. We just need to understand what we can use. And grounding mats, they are excellent. I use myself sometimes in the summers, not in winters, to sleep on the ground. And they are very good. In India, we don't use heating system. In Kerala, you have heating system because you have a lot of, cold weather. For India, it goes to 0 degree where I'm living. But we don't use heaters or heating systems. We just use, we leave it open. We use some warm clothes, that's it. And that's good. We get used to it. And even for the shower, I prefer taking shower with cold water, not with too much hot. Sometimes hot, but very rarely. Cold water is okay.
Can those with Vata take cold water shower because they're already having cold, Vata is cold?
Yeah, Vata people, they can take warm water shower. Pitta people, they should take with cold water. So I'm Pitta, so I take with cold water. It is very important to know your Prakriti.
Civil has another question.
Do you sell medicated oils? Yes, I have all the oils at my website, planetayurveda.com. And we are selling all these oils. That's very good to sleep, to be in touch with the ground, with these 5 elements of the universe. Civil is getting the energy from the ground, the earth energy, knowingly or unknowingly. Basically, Vata, this Kapha is heavy energy, or Kapha contains earth and water. Earth is heavy, ground is heavy. So she is directly in touch with the earth when she is sleeping on the floor. So earth is very heavy and Vata is very light. So when you are in touch with heavy, the lightness goes away. So ground is taking away the Vata. That's why she is getting good benefit. So it was a basic information now how to take care of your back pain. It is important to know that it is possible to cure different health conditions of the back, different concerns, like from moderate to mild spinal injuries or the muscular injuries by simple home remedies. One home remedy I told you, using ginger tea or some application of warm oils and turmeric. You can even boil the turmeric in the milk and consume it every day. I am using in my patients, I'm using this resin of gum resin of a tree. That is, the tree is called Gugul. Gugul tree, the resin is a very strong pain relieving herb. So Gugul resin I'm using in some capsules. I'm making the extract and I'm using the Joint Aid Plus capsules, and I'm using Boswellia curcumin capsules, Planet Ayurveda, and I'm getting good results in the back pain. How do you consume the fennel? Just as it is. The fennel seeds are there and you can get them. And in India, there is a tradition. You must be knowing, Gauri, about this. After every meals, we eat fennel seeds.
Yes.
So why is that? Why is that tradition? Because we are balancing the Vata. After meals, the Vata increases. So just to balance the Vata,
after meals, Vata increases, right? I have noticed this, that the day, like when I had back pains, the day I was fasting, my back pain was actually a bit I would say it was not fasting, complete fasting, but the day I ate only once or something and I had more water or something, warm tea. The back pain was less compared to, like, whenever I would have a meal or a heavy meal, my back pain would sometimes go up right after meal.
So the back pain, so the muscles, they become stiff because of the ama or indigestion also sometimes. When you feel early morning back pain or early morning stiffness, when your back is stiff, when you get up early, whenever you get up in the morning, your back is stiff, that back pain is caused due to ama or endotoxins, or the toxins which are formed in the gut because of indigestion or the low digestive fire, when the meal is not properly digested or cooked by the gut. So that is ama that is causing the stiffness.
I
For
never
that
had that.
purpose.
Early morning was like the best time. I never faced any pain. Early morning was the lightest time for me. It was
That's
after
good.
lunch,
That is
the
good.
night.
So some people, they face early morning stiffness.
Like
For
every
them,
time sleep would just calm it down. Like even if I would sleep a little bit in the afternoon, it would just calm down. Like sleep was so good for my back.
of course, sleep is also decreasing the vata. So sometimes that is also okay. Maybe you have some injury or some that may be the cause. So that's why sleep is improving it. So basic things, if you follow all these basic rules, the back pain will not bother. Drink turmeric milk or turmeric with water. Anybody having back pain, the first thing is ginger and turmeric. And that's it. This ginger and turmeric will heal the injured muscles.
Turmeric helped me.
Yeah.
Turmeric and cinnamon milk.
Any injury.
Yeah.
Turmeric can help in any injury. If you are having this sprain or strain in any muscle or any ligament of the body, even sports injury, any kind of injury. Undigested undigested ama. Yes, physical or emotional. Yes, it can go away with the herb ginger also.
So stress can cause toxin. Stress can lead to less digestive power inside.
Yeah.
And cause more harm.
Stress is people are taking too much stress. That's why I'm saying you need to first of all avoid taking it and avoid giving it.
Melanie has a question.
Yeah.
Yes,
Melanie,
I just wondered what type of milk do you recommend? I don't drink cow's milk. And can I mix the turmeric with cinnamon?
Yes. You can mix it with turmeric and cinnamon. Turmeric is good.
And the type of, and how much of each of those and what type of milk if I don't drink cow's milk?
You can consume almond milk. Just take one, about 200 ml of almond milk and take 1 tablespoonful of turmeric, 1 teaspoonful to tablespoonful. And ginger, if you want to add in that, it should be 1/4 of teaspoonful. Ginger powder, 1/4 of a teaspoonful. So very little quantity of cinnamon, also the same quantity, very little quantity. Cinnamon, very little quantity of ginger. Turmeric, you can add more, 1 teaspoonful.
And should I warm them? Oh,
Yes,
sorry. Warm the milk. Okay.
Yes.
Thank you. Thank you.
Warm it properly so that because the spices, they are dry, but when they are boiled in milk, the dryness goes away. And the heat is also controlled by the coolness of the milk. So, and the coolness of the milk is also gone because of the spices. So that's why they are boiled in milk.
And warm milk.
Warm milk.
Like warm almond milk, like if somebody doesn't drink cow's milk, then any vegan plant-based almond milk should be still taken warm because vata is cold.
Yes.
Should be heated.
Warm, heated. Should be heated.
Thank you.
And this turmeric capsules, Sibyl is asking opinion on turmeric capsules. People are selling capsules of turmeric, and that's not good. Capsules of turmeric is readily available in the kitchen. So, but the dosage of that turmeric in the kitchen is like 1 tablespoonful, because it has very little curcumin or curcuminoids in that. The raw herb or this masala turmeric, which you are finding for your which you are using for your food, that is not having too much of curcumin in that. So once we make the extract of that curcumin, of that turmeric, that can be 5%, 10%, 20%, 60%, 95%. So the turmeric in your kitchen is containing curcumin about 5% or 7% maximum. But for medicinal purpose, it should be 95% to get the real benefits if used in capsule form. If used in powder form, it should be in bigger quantities. So I'm using both. I am using vegetarian capsules of curcumins, not turmeric. People are selling plain turmeric capsules. That is not, they are not effective. Instead of that, you can take raw turmeric.
How do you extract curcumin in your capsules?
So there are certain procedures like boiling them in water, boiling them in different temperatures. So we concentrate and then we check. Just like when you purify the gold from 14 karat to 18 karat and then 22 karat or 24 karat, it is just like that. We check the quality, we check the parameters, whether it is. So it becomes expensive, you know, when something is 5%, something is 95%. So, but the users, they don't know this. The manufacturers know, the doctors know. Similarly, the jeweler knows about the gold. If you are going to buy a ring or a necklace, you go to the jeweler and you don't know anything about what is there inside, how much gold is there. You just go and you just look at the design and you buy it. It is the responsibility of the jeweler to give you the quality. Similarly, manufacturers, they have the responsibility to give you the quality herbs. So if the manufacturers are responsible, they can give you quality herbs. That is their moral responsibility. Consumers, they don't know anything. So the manufacturer, they are selling.
But if I just have to take turmeric for back pain, I'm usually taking organic turmeric powder, like not the normal, but the organic turmeric powder. I just use that. That has helped me so far, but I think it wouldn't have a lot of curcumin in it.
Yes, I'm recommending Boswellia along with that. I have a combination called Boswellia curcumin. I'm using not only Boswellia curcumin, I'm using another product called Jointed Plus. It has some other herbs like gugul. As I told you, gugul is a strong anti-inflammatory resin from a plant, from a tree, a gum from the tree, gugul tree. So I have cured a horse also from that. Very interesting story. The horse was not able to move. It is a 15-year-old story. There was a horse in Connecticut, USA. That horse was being given injections of steroids in the knees. And the horse was around, in 2007, he was around 12 years of age. At the age of 12, he was not able to walk. And the doctor were giving injections in the knees. And then they gave up. They told the owner he cannot walk. It's difficult now. So then the owner contacted me and she bought some Jointed Plus capsules and then they were made up from this gugul extract, standardized. So I told her to give 30 capsules 2 times a day. So she gave 30 capsules, which are actually meant for humans, 2 capsules 2 times a day, but they were for horse. So within about 1 week, the horse was walking, and now it is 2022. After 15 years, the horse is still running. You will be surprised. The horse is still running and alive His age is now 27. Normal lifespan of horse is 30 years. So he is still fine. And they are amazed. They are selling my products in Connecticut to all the other horses also now. All the horses are also getting the benefit of Ayurveda. She launched a company, Ayurveda for animals, using my products. And she is helping all the animals from Connecticut, horses and dogs. So this is how it goes. Once one patient is recovered, it spreads. Curious if the horse had cartilage, or did the horse also have bone disease? It was having bone, because bone degeneration can also be corrected using Ayurvedic herbs. There is a herb called Laksha. I'm using Laksha the Google. There is another herb called Cissus quadrangularis. I can type here. I can type the name of the herb. Cissus quadrangularis. Okay. And another one is Laksha. The Google joined with us and these are the combinations I'm using. This Cissus quadrangularis, this is called Had Jod in Sanskrit. Had means bones and Jod means to join the bones together. So you can understand the meaning why ancient sages named this herb as Had Jod, because it can join the fragmented bones. The bones, it is very good to increase the bone mineral density, bone deposits, and osteophytes. It can repair the osteophytes. So I have seen that in my life. So it is very interesting. This is quadrangularis and Laksha the Google. So all these four things I'm using and I'm getting good results. Even in osteoarthritis, degenerative disorders of the spines, osteoarthritis of the spine or the knees, knee pain also. These herbs, same herbs, they are working.
That's just amazing how you could heal a horse who could not be healed anywhere else. I would.
They made a YouTube video also. They made a full documentary on that horse. They were surprised.
I would want to interview them on my channel.
You can check. I think Ayurveda for animals. It comes up in YouTube. You can search using that.
Yeah.
So that was interesting experience for me also. So after that, I have so many good experience. I'm seeing a lot of patients every day in my clinic. One person came, he had fracture of the knee. It was a big fracture. Okay. And I healed him from ulcerative colitis. He was my old patient. He was suffering from ulcerative colitis, and I have a lot of ulcerative colitis patients, and they are all healed. And he came to me with the knee fracture, and he said, I don't want to go to any other doctor. So he showed me the X-ray, and I was surprised. I told him, it's a big fracture, you need a lot of rest and this and that. He said, I don't want to go to any doctor. You heal me with your herbs. So I gave him Ayurvedic herbs, these gugul and curcumin and boswellia and all these. And the results, they were excellent. Within 1.5 months, I saw the next X-ray. It was all good. And he was able to walk. But I told him to take rest for 2-3 months. But he was happy. And he also gave a testimonial video on my YouTube channel. I have a YouTube channel, Planet Ayurveda TV. So I have a lot of testimonial of different patients, cancer patients, these joint pain conditions.
Pankaj has a question. Pankaj,
Yeah.
go ahead.
Sir, can we treat obesity with Triphala Churna?
Obesity. Obesity is something which is caused because of your habits. In Triphala Churna is very good. It is best for so many things, including obesity and cholesterol and colon cleansing and eyesight and anti-aging. Triphala is for the miracle. But it of course it helps to lose the weight. But it is better to understand the causes why somebody is getting obese. Somebody is not exercising, somebody is genetically obese, somebody is eating too much, somebody is eating rich carbohydrate food. So without just depending upon Triphala, I won't recommend. It is good. It is good to boost your morale. You will of course lose some weight. If you don't want to do anything, start with Triphala powder. That is good. So once you lose weight, you should encourage yourself for exercise and diet control also. Consume a lot of fruits and vegetables and salads. And then, of course, it will also help. Cut down on rice and wheat bread and consume more millets. Millets are very good to lose weight. If you switch over to millets, jowar, bajra, ragi, barley and all foxtail, barnyard and other millets, then it is very good. You can lose weight.
Sir, obesity is coming after AVR surgery.
AVR is which surgery?
Aortic valve disease.
Aortic valve surgery. Okay. So basically, you are the patient is not exercising or walking, right?
Right.
So other than Triphala, there are many other herbs, liver detoxifying herbs, stronger herbs than Triphala. Haritki, because Triphala has Haritki, Vibhitki and Amalaki. These three herbs are there. Haritki is very good to lose weight. And other than Haritki, you can use Kutki. Kutki is also very good for it's a Lekhni or very good for losing weight. Garcinia is also there, Amalvetas. So Garcinia you can use to lose weight. Even turmeric is good. Turmeric is very good to lose weight.
But for losing weight, these herbs are excellent as a choice because they're herbal and natural. But they would help mostly people who are having trouble losing weight even when they switch a diet and they have other underlying conditions, maybe thyroid or something, or they're having problem losing weight. Then they might need herbal supplements, but like the regimen is important. The food that people are eating, like if they are eating turmeric, but they are eating too much other unhealthy food and they're putting turmeric on top, that's not going
That is not recommended. That's not going to work. In this case of aortic valve replacement surgery, in this case, the patient is not able to move or exercise too much. Arjuna is very good for even for losing weight and also for the strength of the heart of the valve. So Arjuna is a herb which is good for heart. Arjuna is good for the weight loss also, good for cholesterol also, good for prevention of thromboembolism or thrombus formation or the clot formation in the arteries. So Arjuna, he must consume. Arjuna powder is there. Arjuna tea, we have Arjun tea. And I have Arjuna capsules also. But he can get, if he's in India, he can get Arjun powder from nearby Ayurvedic store.
Clogs in arteries also form due to calcium, right? Not just cholesterol.
No, they are not because of the calcium. Calcium is hardening the arteries. calcium deposits are occurring inside the in the arteries. So the flexibility is lost. So that's why, because of the low flexibility of the arteries, certain problems are there.
Does
That is called
Arjuna helps with that?
Arjuna and Amla. This Trifla is helping in that also. Amla is very good. Amla is anti-aging. It is, what is aging? Aging is hardening of the arteries. That is aging. How we age, what is called aging from medical perspective. It is just hardening of the arteries. When the arteries are losing their flexibility, we age. So once we lose the flexibility of the arteries, the aging is happening. So to prevent the flexibility, loss of flexibility, exercise is very good, and consuming of lot of vitamin C. Amla is richest source, amlaki. And amlaki is available in the juice form, in the tablet form, in the capsule form, in the powder form, in the trifla form. Trifla, three means three. Phala means fruits. So 3 fruits are there in trifla. And all 3 fruits, they are very useful anti-aging. Okay.
Sir, patient can take Triphala Chuna and Arjuna with turmeric Chuna.
What? Trifla? I was reading comment by Divna. She was saying my foot fracture was healed by Dr. Vikram with Google Baswiliagar Cumin few years back. It took only few weeks. Can you speak, Devna, about this?
2 weeks only.
Huh?
Yeah.
Huh? Tell me
Yeah.
your story, what happened, when it happened.
Yeah. I slipped on a path and I
Okay.
sprayed my foot. It turned out that there was a fracture there, and I was supposed to have a cast or something on the foot. And then I turned to Dr. Vikram, and he told me Google and Boswellia curcumin and rest a little bit more than usual. So that is what happened. The only thing that I was doing, I was going to the pool, the swimming pool every day, just putting my foot into the water, and the movement of the water, I think it helped as well. That is what happened. I mean, it was no no other medications, no cast, nothing, and the fracture was just healed. That's on the foot, which is very difficult, I think.
Yes, yes. I'm glad that to know that. And also about your husband eyes problem. You shared something with me. Can you share it here? What happened?
Yeah. My husband's story is a little bit more difficult. For years, he has high blood pressure, and he controls it with sarpaganda, and sometimes he has to take some more medications. And in September, he had a stroke, the bleeding stroke.
Yeah.
His memory was affected, but mostly his eyesight was affected, because the blood was actually covering that center of the eyesight, and he had a headache in this part of his forehead. They sent him to he went to see an eye doctor, and she sent him to the emergency. They just saw that it is still blood there. It is leaking a little bit, but it stopped in 24 hours, and they released him. They didn't give him any medication or anything. They said that only his blood pressure should be treated.
Okay.
And he continued with his treatment of the blood pressure. He came back home, and we asked Dr. Vikram how we continue. What do we do? Because no medication, nothing was given to my husband. And Dr. Vikram started with Gotukola, Amalaki Rasayan, and when all his functions were back, memory as well, only the eyesight, the peripheral eyesight was still affected. And then Dr. Vikram told us Amalaki Rasayan and what was the other one? Gotukola.
Yeah, Gotukola I recommended.
I think that it was Gotukola to increase the dosage, and it took, Dr. Vikram told me that it will take 1 month and his eyesight will be back. And I told him, thank you for your kind words. And he told me, no, these are not kind words. This is experience. You'll see in 1 month, his eyesight will be back. That was exactly what happened. We went to his eye doctor because he couldn't drive because of he lost of the peripheral vision. She told him, don't drive. And he had to give her consent whether he can drive or not. His eyesight, he was pretty convinced that his eyesight is pretty much back. I was not convinced. We went to the eye doctor. She told us, when she saw us, she told us, you know, after this kind of stroke, eyesight never comes back. Okay. And I told her, you know, our doctor told us that once the blood is cleared, eyesight will be back. Yes. Okay, let's make the check.
Yes.
And she did the eye check. She was amazed. She said, you're just fine. You can come to me after 2 years.
Okay.
I mean, she intended to keep him coming every 3 months just to check his eyesight. That is what happened. And my husband is now just fine. Thank you, Dr. Vikram.
So these kind of testimonials and these miracles I'm seeing every day in my clinic. And this Gotukola is very good to improve the circulation, especially in the microcirculation, in areas where the circulation is very low. So I'm getting very good results in all eye problems, in retinal detachments, in retinal injuries, in optic nerve blockage. There is another disease, CRVO, retinal vein occlusion. In those cases, I'm seeing these results with Gotukola and Amalaki Rasayan.
Yeah.
So thank you for sharing your experiences with Ayurveda.
Thank you for helping us.
Blood pressure and stroke, you can also, like, of course, the herbs are the best when you are already in a critical situation. But you can also prevent, and you can also do better with improving your food and your diet, and make sure to eat healthy.
Yeah.
You know, it is very difficult to have a husband, 66 years old. It is always his way. So it is very difficult to influence his diet and things like that. But once the stroke happens, then he came to his senses. Now,
That's good. That's good. That's,
yeah.
Sometimes misery is a good teacher.
So I think it was a good session. We shared lot of views.
Sybil had a little question, so I will just let her know that she had a bone on knees but very little pain due to grounding mat and diet changes, but want to be proactive about knee and joint health. And she said that you would recommend her herbal treatment first. So Sybil, I think Dr. Chauhan will probably say that herbal treatment will help, but any medical advice, we would recommend that you would get directly from him and also consult your primary care physician. We are not trying to say that this is a replacement for any allopathic treatment, but this is definitely, it has helped. So it is a good information. The choice will be yours completely. So if you have a personal problem, Dr. Chauhan has a website if you want to contact him, planetayurveda.com. And from this platform, this is just for information. We are not giving any medical advice. And we do not also recommend that you leave your primary care physician or anything like that. So make sure you make your choices based on the information that you get. And Ayurveda has been very helpful, and it has really helped heal. And we hope that Ayurveda would find its benefit in many people's life. But make sure you make your own mind, and do not miss your doctor appointments, or do not try to not see your primary care physician. So we do not recommend that. And so this is mostly for information, and for Ayurvedic consultation, you'll have to make your choice directly to consult Dr. Chauhan.
Well, I am in India, and according to, we have Ayurveda here since ancient times, and we are using Ayurveda in every household, and we are quite used to it, used to even the healing aspects of it. So in Canada, situation is different, maybe different. Canada people, they don't know much about Ayurveda, America or Canada. So it is something new. Maybe 30, 40 years ago, they came to know this word, maybe 20 years ago. Some even don't even know, even now also, they don't know what is Ayurveda. So I have a website. You can go through the website. You can read about what is Ayurveda. So I'm seeing a lot of patients. There is a formal degree in Ayurveda in India. So I have done that. And in my life, I have seen amazing results and wonderful results. So it's okay. You can contact me through the website. And you can view my channel, Planet Ayurveda TV is my channel in YouTube. So in that channel also, I have made a lot of testimonials and videos, informative videos. So you can see and go through them. Okay, thank you for being here, and thank you for everything, sharing your experiences also and your questions. And we will definitely plan something new next time after a month or so.
Yeah, Dr. Vikram Chauhan has promised us that every once a month he will give us a webinar. So I'm very grateful to him for that. And I look forward to more informative sessions and more information to be spread so that there's more awareness about Ayurveda. And
I am actually not, I am not advertising or promoting these webinars through my channels. Because if I promote, and there will be too many people to attend the webinars, and there will be so many questions. So we won't be able to finish that. So it is better to have 15, 20 people and share this knowledge over YouTube, and every other person, they can watch the video and get the information. That's better.
Yes. That's just really amazing that like we could get this information out to as many people out in, especially in Canada and US. Also, so Dr. Chauhan already has many people globally that he is treating and helping them out. So we want the message of Ayurveda to spread, so people know more about Ayurveda, because it's a very ancient wisdom. It's a philosophy also. It's not just drugs and herbs, but it's your body type, your doshas, and the 5 basic elements. So there's a lot of philosophy behind it. So Dr. Chauhan is wonderful at teaching. So
thank you very much. I have another webinar coming. It is International Congress on Ayurveda. It is being organized in Eastern Europe or Russia, I think. So they invited me for a talk on autoimmune disorders. It is on 30th of January. So there is the information is available at my website. If somebody is interested or suffering from severe autoimmune disorders, I'm thinking it will be very useful for those patients. 30th January 2022, and the information is available at my website in the events section.
okay, so I have given the link to your website in the chat so people can access. And and also, like, I have my own company where I am hosting these webinars, and I will give the link to my company. So coming forward, there will be webinars in Ayurveda, and Dr. Chauhan's webinars will be hosted there as well. So so my company is not selling any herbs. We are not Ayurvedic consultants, but we are promoting and propagating the Ayurvedic wisdom and advertising for it through our platform. And once a month, we'll definitely have Dr. Chauhan come in here for this talk, a wonderful talk, and a good amount of information. So we get to learn. So hopefully Dr. Chauhan will have like more time to probably help us learn more basics and principles of Ayurveda also in future. So I really look forward to having.
I think we can do the next talk on autoimmune disorders itself.
Autoimmune disorders, okay.
Yeah, there's so many of them, like nephrotic syndrome, scleroderma. There is ulcerative colitis. There are so many autoimmune hepatitis, liver disorders, multiple sclerosis. So many autoimmune disorders.
We can pick one, or we can just do a general talk first.
We can general autoimmune. Rheumatoid arthritis is also autoimmune. Psoriasis is autoimmune. So all these autoimmune disorders, there is a very good result. There are very good results in Ayurveda in autoimmune disorders. So we can discuss all of them in one webinar. Okay.
Okay.
Thank you very much.
Thank you so much. Thanks to everybody who could join us today. I know it took long. Some people left us on the way, but I'm glad so many people could join, and I look forward to having more people come in next time, and hopefully we could grow the Ayurveda community in Canada and US, and we all can learn the ancient wisdom together. So thank you so much, Dr. Chauhan, for your time. Thank you so much to all the audience today who came, contributed to the questions, and showed interest in learning. Thank you so much.
Thank you very much. Take care.
Getting the benefits of natural Ayurvedic treatment is so easy now. No worries about traveling and lodging expenses. No need to delay your traveling plan to India or any other country for doctor's appointment due to other work commitments. No stress of embassy and other legal permissions. Save your time and money. Avail online good, effective Ayurvedic consultation from top Ayurveda experts at www.planetayurveda.com. Your best friend for a healthier, happier and wealthier life. Experienced team of Ayurveda doctors with effective skills to help you follow Ayurvedic principles of healthy living. Private, personalized and online mode of consultation in the comfort of your home. Exclusive Ayurvedic clinics, centers, branches and outlets worldwide. Worldwide home delivery of pure natural herbal supplements available. Book video consultation now with MD-Ayurveda experts. Call or drop a WhatsApp message on any of the helpline numbers on your screens. Fatty liver, liver cirrhosis, ulcerative colitis, ITP, chronic kidney, skin, lung diseases, neck, back, knee pains, arthritis, psoriasis, migraine, gynae problems, diabetes, belly fat, scleroderma, various types of cancers or any problem. Only one solution, www.planetayurveda.com. Not just this, adopt and follow natural Ayurveda and spread it with people around you for a healthier and disease-free planet. For franchisee, visit now www.planetayurveda.com.